I once had a patient who was a diabetic, and in 4 years, he was hospitalized 6 times with pneumonia. Poor fellow had exhausted his entire insurance amount. When I asked him, "Have you not been given pneumonia vaccine?" He says, "No. We gave him pneumonia vaccine, and after that, he died after 4 years. But in those 4 years, he never had pneumonia." So, pneumonia vaccine ideally should be given above age of 60, but in a diabetic above the age of 50. It is seen anyone has to ask a question to a doctor. 8 out of 10 times, it is not concerning a prescription, but a doubt one may have in his or her own mind about a health issue or something you heard. Well, for all such doubts, all such queries, we are here at Dr. Saab, Hindi on Wednesdays and English on Fridays. Do subscribe and share our podcast to your contacts and friends. Hi, listeners. So, our this episode is dedicated to certain vaccines for the adults, or as we call as adult immunization. Today, there is a change in the anchor. I have Preeti Desai to ask questions which have been put up by our listeners even after just 3 episodes have been aired. Welcome, Preeti,
Thank
to
you, sir.
the English podcast, Adult Immunization.
So, I've been wondering vaccines are usually given to children, but in adults, we have seen that they get just immunized with this tetanus vaccine when they're hurt or injured. So, sir, what is this new concept of adult vaccination?
See, this is where you all don't think. I am sure you've taken COVID vaccine
Yes, sir.
and you are an adult. So that is an example of adult immunization. We need to immunize our adults. Similarly, there are several illnesses which cause severe morbidity. People take a long to recover or they lead to death. The same reasons for which we insisted that the entire population of the country get COVID vaccine administered. There are vaccines which adults should take to prevent certain diseases. Certain vaccines are advised for all adults, and certain are advised to people who are more at risk. So, I may say a particular vaccine, say influenza, a 60-year-old person ideally should take, but if he wants to take a risk, that's up to him. But if I have a diabetic, then I will at 50 also tell him to take once a year because diabetics are more prone to get influenza. I hope that is clear why adults need immunization.
Yes, sir, very clear. Sir, an adult means a person above 18 years of age. So, are adult vaccines given after 18 years and above?
There are certain vaccines which we start even at 15, and those vaccines are not called child immunization. One such vaccine, which is getting more popular lately, is HPV vaccine, human papilloma virus vaccine, which initially was started to be given in girls only because it prevents cervical cancer, cancer of the mouth of the uterus. But now it is even being recommended for boys because it prevents cancer of the penis. So I would say that is to be given from 15 years onwards. So that is the most important vaccine, I would say, that adults have to take. Then there are certain vaccines which all don't have to take. One is the chickenpox vaccine. Now, as we grow, and if we have not taken chickenpox vaccine in our childhood, as we grow, the attack of chickenpox is much worse than what it used to be in childhood. So, if anybody of say 20 years, 25 years has not suffered from chickenpox, I would recommend a chickenpox vaccine because it gives lifelong immunity against chickenpox and another skin infection called herpes. Then hepatitis A, because youngsters keep eating out, and hepatitis A vaccine prevents a kind of a jaundice. So that also is voluntary, but we recommend to take for young people who are eating more from outside or roadside food. Then people who eat from out, I would say a typhoid vaccine once every 3 years. So these are the vaccines which we will recommend to all population. Then there are certain vaccines which we recommend to truly above 50 years.
So which are these vaccines?
As I mentioned to you, one is influenza, second is pneumonia vaccine. I once had a patient who was a diabetic, and in 4 years, he was hospitalized 6 times with pneumonia. Poor fellow had exhausted his entire insurance amount. When I asked him, "Have you not been given pneumonia vaccine?" He says, "No." We gave him pneumonia vaccine, and after that, he died after 4 years. But in those 4 years, he never had pneumonia. So, pneumonia vaccine ideally should be given above age of 60, but in a diabetic above the age of 50. Or if the patient has chronic kidney disease, is on dialysis, then you give pneumonia vaccine. It is to be given once every 5 years. In addition to pneumonia, as I said, you have to give influenza vaccine, which today I recommend to everyone, even people about 20. Influenza vaccine is given to children also. But today our life is such that a student cannot afford to take leave from school for 10-15 days, or you cannot miss work for that long. So then influenza vaccine once every year keeps you safe from influenzas, four types of influenzas. So that we recommend. But elderly, I will say above 60 must take, above 50 with diabetes or chronic kidney disease should take. Then there is another vaccine called hepatitis B, which we normally take in childhood. 60 years back, hepatitis B was not a part of the mandatory vaccination. Today it is so. So, all my listeners who are above 50 years and who have not been immunized against hepatitis B, please take 3 shots of hepatitis B, because hepatitis B virus, if you get it, leads to cirrhosis of liver and maybe cancer of the liver. So, it is a great preventive for cirrhosis of liver and cancer.
So, sir, which other vaccines like tetanus we should take? We should go for.
See, there is a vaccine called rabies, the dog bite vaccine. Before HIV came on the scene, rabies was the only disease which had 100% mortality. So, if 100 people get rabies, 100 will die. There is no treatment also. They are just put in ICU to give them a peaceful end. Many people get bitten by dogs, but they avoid getting injections. Earlier on, it was scary. You had to take on your abdomen, but now you have a proper intramuscular in the arm. It is not only dog vaccine. If you get bitten by a horse, by a monkey, people who go to forest, photographers, if you get bitten by any wild animal, like a fox, you should take anti-rabies vaccination. Then even cat bite, we have to give dog bite vaccine. So this is a must. And then people say, yeah, but I was traveling, so it has been 10 days since I took. Rabies virus remains in your body for as long as 20 years also. It gets activated when the weather is cold. So it has happened that a person got bitten in Bombay by a stray dog, ignored the vaccine. 10 years later, went to Switzerland. The virus got activated and he died there. Another precaution I would say, whichever vaccine, every vaccine has a mode of administration. Like most vaccines are to be given in the arm near the shoulder. They cannot be given on the buttock because hips, buttocks have a lot of fat, less of muscle. The vaccine doesn't get absorbed and is not effective. So ask the doctor. If the doctor insists on the arm, please take it on the arm. And always take rabies vaccine. You should not ever avoid just for the sake of love of your family members.
So, sir, if I've taken the full course of the vaccine and if I get bitten by a dog after 6 months, should I take the vaccine again?
Very good question, Preeti. If you're taken a full course of vaccine and this time you had the bite on the leg, the bite after 6 months is on the face or on the hand, then you take a full course. If the bite is again on the leg, or the first one was on the hand and the second one is on the leg, then one dose only is enough. The efficacy of full course lasts for almost 1 year. Another point, all vaccines must have a cold chain. They get destroyed exposed to normal room temperature. Make sure your doctor has a working fridge. If you're buying from a chemist, do not just carry and wait in the waiting room. The vaccine will get destroyed. You reach the doctor's clinic, tell them to put in the fridge till your turn comes. That cold chain has to be maintained. When we order vaccines, we make sure that they're delivered to our clinic in proper cold chain. So these are the few things that you have to take care.
So, my brother is traveling to US next month for his studies. So, which vaccines he should take before going there?
See, every university in United States has their own requirement, but they make sure that you've taken 2 doses of MMR. They make sure that you've taken a vaccine called meningococcal meningitis, which is not part of our routine immunization program in India, but we always give to people who travel overseas for education or long term. It is a requirement by the university, more so if you're going to stay on campus. Many universities waive off this if you're not going to stay on campus, but in your independent accommodation. Otherwise, all the childhood vaccinations, polio, triple, hepatitis B, MMR, all those you have to give evidence that you're taken.
Sir, we wanted to know more about the vaccines which a pregnant lady should take.
See, as you know, that a fetus growing in the mother's womb takes all the immunity from the mother. So, the first and the most important vaccine we have to give to a mother, pregnant woman, is injection tetanus toxoid, 3 doses in the 7th, 8th, and 9th months of pregnancy. Some doctors insist on only 2 at 6 week interval, otherwise 3 at 4 week interval. Then nowadays, because girls are getting or women are getting pregnant late, as a part of pre-pregnancy planning, they conduct a test for rubella. Rubella is German measles. It is the commonest cause of abortion in the first trimester. So, if the lady does not have protection against rubella, then they give rubella vaccine to the lady before she conceives, because we want to avoid abortion at any cost. Abortion in first trimester, the commonest cause is rubella. So 3 tetanus shots and then rubella if required. Then, of course, if the COVID vaccine is due during pregnancy, it can be taken with the gynecologist's permission. So I think, Preeti, we have talked enough of adult immunization, and I only hope and pray that our listeners follow this advice and either take themselves or make sure that their elder family members are given these vaccines, because you are going to do a great service to them by preventing all these ailments. Thank you.
So, sir, what about our next episode?
A lot of questions have come on what preventive checkups we should do. So I think next episode we'll devote to preventive health checkups, because there's a lot of confusion. So friends, follow us on our podcasts to get information about future episodes and circulate among your friends. Also, come back to us if you have a query about anything that we have covered or we have not covered so far. Thank you.